Welcome. Our skin is an incredible organ, serving as our body's largest and most visible protective barrier. It shields us from the environment, regulates temperature, and allows us to feel. Yet, despite its resilience, our skin is also susceptible to a variety of common issues. Understanding these conditions is the first step toward managing them effectively. Many people experience skin problems at some point, and knowing what you're dealing with can alleviate anxiety and guide you toward appropriate care. This discussion will demystify some of the most prevalent skin concerns. Acne is perhaps the most common skin condition affecting millions worldwide, particularly teenagers and young adults. It occurs when hair follicles become clogged with oil and dead skin cells. This blockage can lead to inflammation and breakouts. The primary causes include excess sebum production, bacterial growth, hormonal fluctuations, and inflammation. Acne can manifest in various forms, from blackheads and whiteheads to more severe cysts and nodules. It often appears on the face, neck, chest, and back. While often associated with puberty, acne can persist into adulthood or even begin later in life. Effective management involves a consistent skincare routine, topical treatments, and sometimes oral medications. Consulting a dermatologist is crucial for persistent or severe cases. Eczema, also known as atopic dermatitis, is a chronic inflammatory skin condition characterized by dry, itchy, and inflamed patches of skin. It often appears as red, scaly, and sometimes weeping lesions. The intense itching can be particularly distressing. Eczema is believed to be caused by a combination of genetic predisposition and environmental triggers. These triggers can include allergens, irritants like harsh soaps, stress, and changes in temperature or humidity. It can affect people of all ages, from infancy through adulthood. Managing eczema focuses on moisturizing the skin regularly to maintain its barrier function. Identifying and avoiding triggers is also key. Topical corticosteroids or other prescribed medications may be necessary to control flare-ups and reduce inflammation. Psoriasis is a chronic autoimmune condition that accelerates the life cycle of skin cells. Normally, skin cells grow and shed over a month, but with psoriasis, this process takes only a few days. This rapid turnover leads to a buildup of cells on the skin's surface. The most common form, plaque psoriasis, presents as thick red patches covered with silvery scales. These patches often appear on the elbows, knees, scalp, and lower back. Psoriasis can also affect the nails and joints. While the exact cause is unknown, genetics and the immune system play significant roles. Psoriasis is not contagious. Treatment aims to slow skin cell growth and reduce inflammation, often involving topical creams, light therapy, or systemic medications. Rosacea is a common chronic inflammatory skin condition primarily affecting the face. It typically causes redness, visible blood vessels, and sometimes small, red, pus-filled bumps. It can be mistaken for acne due to the presence of bumps. Rosacea often begins with a tendency to blush or flush more easily. Over time, the redness may become persistent, particularly across the nose, cheeks, forehead, and chin. Triggers can include hot beverages, spicy foods, alcohol, sunlight, and stress. There are different subtypes of rosacea, each with distinct symptoms. While there is no cure, various treatments can control symptoms and prevent progression. These include topical medications, oral antibiotics, and laser therapy to reduce redness and visible vessels. Dry skin, or xerosis, is a very common condition characterized by a lack of moisture in the outermost layer of the skin. It can feel tight, rough, itchy, and may even appear flaky or scaly. Severe dryness can lead to cracking and discomfort. Factors contributing to dry skin include cold weather, low humidity, hot showers, harsh soaps, and certain medical conditions. As we age, our skin naturally produces less oil, making us more prone to dryness. Effective management involves regular moisturizing, especially after bathing, using gentle cleansers, and avoiding prolonged exposure to hot water. Hydrating ingredients like hyaluronic acid and ceramides can significantly improve skin comfort and health. Oily skin is characterized by an overproduction of sebum, the natural oil produced by our sebaceous glands. This excess oil can lead to a shiny complexion, enlarged pores, and a greater propensity for acne breakouts. Genetics, hormonal changes, stress, and certain medications can all contribute to oily skin. While it can be challenging, oily skin often shows fewer signs of aging as the extra oil helps keep the skin supple and hydrated. Managing oily skin involves using gentle oil-free cleansers and moisturizers. Products containing ingredients like salicylic acid or niacinamide can help regulate oil production and minimize pores. Avoid harsh scrubbing, which can stimulate more oil production. Hyperpigmentation refers to patches of skin that become darker than the surrounding skin. This darkening occurs when there is an excess production of melanin, the pigment that gives skin its color. It can manifest as sunspots, age spots, or melasma. Sun exposure is a primary cause, leading to sunspots or freckles. Melasma, often called the mask of pregnancy, is triggered by hormonal changes and sun exposure. Post-inflammatory hyperpigmentation can occur after skin injury or inflammation like acne. Prevention is key, primarily through consistent use of broad-spectrum sunscreen. Treatments include topical creams with ingredients like vitamin C, retinoids, or hydroquinone. Chemical peels or laser therapy may also be considered for more stubborn cases. Sensitive skin is not a medical condition itself, but rather a common characteristic where skin reacts easily to various triggers. It often feels tight, itchy, or stings, and may show redness or irritation in response to products, environmental factors, or stress. People with sensitive skin often have a compromised skin barrier, making them more vulnerable to irritants and allergens. Fragrances, dyes, harsh chemicals, and even certain natural ingredients can provoke a reaction. Managing sensitive skin involves identifying and avoiding triggers. Opt for products labeled hypoallergenic, fragrance-free, and for sensitive skin. Patch testing new products on a small area of skin before full application is highly recommended. While understanding these common skin concerns is empowering, self-diagnosis can be misleading. Many skin conditions share similar symptoms, and what appears to be one issue might actually be another. For persistent, worsening, or concerning skin problems, consulting a dermatologist is always the best course of action. A medical professional can provide an accurate diagnosis, recommend appropriate treatments, and offer personalized advice. Remember, your skin is unique and its needs can change over time. By being informed and proactive, you can maintain healthy, comfortable skin throughout your life.